Hi everybody, Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, and today I'm presenting on a topic called the benefits of shockwave therapy for tennis elbow. And tennis elbow is one of the conditions that we see a lot of here in the clinic, and it is when there is strain and sprain on the outside part of the elbow called the lateral epicondyle of the elbow, leading to inflammation and a diagnosis of lateral epicondylitis. Now, that's commonly referred to as tennis elbow. So today I'm going to talk about tennis elbow. I'm going to talk about different treatments, including shockwave therapy for tennis elbow, and then some of the other treatments that we do here in the clinic. So my name is Dr. Cary Yurkiw. I'm a chiropractor here at Tut Street Family Chiropractic, and that's in Kelowna, British Columbia. And I've been practicing for 30 years now, and I've seen a lot of patients over the years, thousands of patients for different conditions, including tennis elbow. And my journey into chiropractic started when I was a teenager. I had a lot of knee pain, and my family took me to our family doctor. He didn't really know what the problem was. He thought it was just growing pains. And then my father took me to a chiropractor, and the chiropractor assessed me and determined what the problem was. And when he gave me that diagnosis and started treatment, it really made a big difference. It definitely changed my quality of life. It changed the sports that I was able to play. It just made a big difference. And so from that point forward, I decided I wanted to become a chiropractor. And today I'm very excited to share this information with you. I do really like doing these webinars. This morning I was getting my hair cut, and my stylist was talking about the webinar and saying, do I like doing them? And it is one of my more favorite things to do, is to write blog articles, to share video like this one, and to do podcasts. So very excited to do this today with you. And I'm going to showcase some of the services we have to offer, how we go about treating people in the clinic with this condition. So what is tennis elbow? Its diagnosis is lateral epicondylitis, meaning inflammation of the outer part of the elbow. And that can cause symptoms. A lot of times, just lifting something up, especially if you're extending your wrist backwards and lifting something, it tightens the muscles on the forearm that insert on the outside part of the elbow, and that really makes it painful because it's already inflamed, it's already painful. So if you do an activity that's going to aggravate it some more, it's going to be really painful. The reason they call it tennis elbow is a lot of tennis players roll their wrist and turn their elbow as they do their swing. So whether it's the forehand or even more the backhand, when they're doing the backhand and rolling the wrist, they're going to put a lot of impact on the elbow, because when you hit the ball, you're turning your wrist, it's going to strain that area. And if you do that repetitively, that's where the inflammation and the injury can come in, and that's where it can last a long time if you're repeatedly injuring the elbow. But other people get it too. People that are using a wrench and twisting the wrench, people that are lifting things, especially up like that, can get tennis elbow as well. And it's very painful. If you've ever had it, it weakens your arms. It makes you distracted with the pain, and very hard to do activities that you love to do, including sports. So today we want to talk about the treatments and the limitations to those treatments. So conventional treatment for tennis elbow includes rest, ice, anti-inflammatories, cortisone injections, and physical therapy. So most of the time when someone has this, they go to see the doctor. The doctor gives them ice or heat. If it just happened, ice is better for it. So if you're recently injured it, putting ice on the elbow and reducing the inflammation is a good idea. And then resting it helps the body to heal and repair. Anti-inflammatories can be good initially when there's a lot of swelling. Cortisone injections are a powerful anti-inflammatory, a steroid that goes into the area to reduce swelling. So sometimes that is used, but usually not initially, more so when the problem is there for quite some time. And then physical therapy. Now, physical therapy can include different modalities like ice and heat, stretching, interferential current, different like TENS machines, different machines that can help to decrease the pain and to heal that tissue. Now today I want to talk about shockwave therapy, and I'm just going to move my picture over here to the other side so you guys can see. And regarding shockwave therapy was developed way back when they were trying to break up kidney and gallstones, something called lithotripsy, to blast out calcium deposits and improve and to pass the calcium deposits through, or the stones through. So the technology has been around for a long time, but it was modified to treat joints and musculoskeletal conditions. And the scientific mechanism behind the effectiveness, or stimulating healing and reducing inflammation, is well documented. So I actually put together a few references here. Let's see if I can get this over for you guys. Hopefully you can see it. But this is the retailer or the product manufacturer that we use. It's Shockwave Canada, and the unit is by Stores Medical. It's right behind me over here, if you can see it. I'll just pull it into the picture. And this is the Shockwave. So this Shockwave unit has a compressor, and then it has the Shockwave head that allows us to do the treatments right here. And I'll tell you more about how this works, but it's a very powerful tool to get rid of calcium deposits, scar tissue, and promote tissue healing. So as far as the technology goes, if you go onto the Shockwave Canada website, what you're going to see is the technology, how it works right here. So shockwave therapy accelerates the healing process in the body by stimulating the metabolism and enhancing blood circulation to regenerate damaged tissue. Shockwave therapy and technology delivers strong energy pulses that are applied to the affected area for short periods of time. This stimulates cells in the body that are responsible for bone and connective tissue healing, and in many instances, shockwave therapy treatments have proven to be effective in cases where the human body has not been able to heal itself on its own. So it's pretty amazing for a number of different conditions. It continues right here to say shockwave therapy produces an acoustic pressure wave that is transmitted to the body's tissue. The pressure wave created at that point of contact transmits radially inside the patient's body. So it kind of penetrates into the body to promote healing of the tissue. So that's the science behind it. Now, it does bring in more blood flow in the area. It does heal the soft tissue. It does deal with some calcifications. And remember how it was developed years ago. Here's a picture right off the Shockwave website where it shows some calcification of the tendon in the rotator cuff. And as the shockwave is done in 6 weeks, you see less calcification of the tendon, and eventually in 6 months it's totally gone. So the tissue is healed. So it's pretty powerful, even in cases where there's been an old injury, where there's calcium deposits, scar tissue. Very powerful technique that we can use on the shoulders, the elbows, the wrists, the feet, the knees, hips, along the spine. So we do it for a number of different reasons. Now, what does it feel like? Often people will ask me when I'm doing their shockwave, what can I expect? How is this going to feel? And initially, what you're going to feel is a tickle. So as the shockwave impulses are going into the tissue, you feel kind of like a stimulation, a tap, tap, tap on the elbow. And then that can cause some redness and swelling. And then as it causes more swelling, the nutrients are brought into the tissue to help promote healing of that area. In this case, we're talking about tennis elbow, so into the elbow joint and the insertion of that muscle group into the bone on the outside of your elbow. Now, with the treatment plan for Shockwave, usually what I'll do is I will assess the person. Depending on the assessment, I will sometimes start with Shockwave, and on the next session do laser, and we'll talk about laser on a subsequent webinar. I'll show you the upcoming webinars because there is a webinar on laser. But I'll do Shockwave and laser, which is light therapy, and Shockwave is acoustic waves, sound therapy, that goes into the body. So there's two different ways that I'll start with the patient and alternate, and then I'll see which one's working better and then go with the one that's working better. And I usually do 6 sessions for the patient and then reassess them. If the 6 sessions has gone well, I'll give them an update. I'll give the patient an update. You're at 60%, you're at 80% recovery. And then I'll extrapolate out, it's going to take us 2 to 3 more weeks to see complete healing. Or I'll schedule them every other day or twice a week for 2 to 3 weeks to see how they're progressing with care. So depending on the condition, how long it's been there, any complicating factors, I will schedule treatments and a treatment plan, find out which technology is working better in our clinic, and then reevaluate after that time. In addition to Shockwave and laser, which I touched on today, I do multiple different techniques, and this can include hands-on adjustments, which is traditional chiropractic adjustments. I do instrument adjusting, so using the activator to do adjustments. I use the integrator, which is a different technique, very gentle tapping on the spine to realign. And I also use instruments like the Shockwave, the laser, and the Y-strap to do spinal decompression. Laser is applied similar to Shockwave, although Shockwave is more mechanical. You do feel the impulses in the area, and you can feel that tapping on the outside part of the elbow. With laser, it's a light therapy. Some people don't feel anything when it's being done. Some people feel a little bit of warmth or tingling, but what it's doing is sending light therapy into the body to heal the joint, stimulate the mitochondria, and heal the tissues. Another service that I offer here in the clinic is health coaching. And what I mean by health coaching is some people are predisposed to re-injuring their elbow. Some people need help as far as stretches and exercises, and then ways to improve their ergonomics so they don't hurt themselves. So for athletes, people working in the trades, patients that need that extra help, I'll give them advice on nutrition, on rest, on stretching and strengthening so that it'll heal the elbow completely and the problem doesn't come back again. So that coaching is similar to a chiropractic session. I do it here in the clinic, or I do it via Zoom or Google Meet to make it a little more convenient for the patient. We also have products in the clinic. Sometimes a sleeve or a wrap around the elbow can help to support the elbow. I don't like the sleeves or wraps long term because it's a bit of a crutch for the person to rely on, but temporarily it can be good. Eventually we want to get rid of that sleeve, build up the strength, restore the function and the alignment so that it can function on its own. So that's the goal. And not everybody can get to that place, but for the majority of my patients, we want to totally restore the alignment and the function of the elbow. I do reassessments in the clinic, whether it's chiropractic or Shockwave, and I do them on regular intervals to make sure the patient's responding the way I expected, to give them an update on their healing process, to explain what they can do to help themselves. So I think the care that we provide here in the clinic is very comprehensive, and it's accountable to the patient. And then there's accountability that the patient has to us too, as far as doing their stretches and exercises to help the process along. So teamwork can really get us there to where the patient needs to be. So in conclusion, the key takeaways from today are that Shockwave can help with tennis elbow. Tennis elbow is a strain that people experience when they do sports, when they're doing repetitive movements with their elbow, like turning a wrench or a ratchet, or doing things with their arms that are repetitive. And Shockwave and chiropractic can be very effective to help people with this condition. Now we are accepting new clients at the clinic. So if you're in the Kelowna area, you're looking for a chiropractor, please call us, or you can schedule online at Tut Street Family Chiropractic. I'm going to pull over a slide here now. Pretty easy to do. So when you go to our website, which is tutstreetfamilychiropractic.com, you can just click on the book now, or for new patients, click here. And that'll take you over to our schedule, the days and times that are available. We are in 7 days a week, and we are open from morning till evening on most days. We can usually get a new client in the same or the next day. So often it's very convenient for the patients. And then we bill directly to insurance. So we bill directly to about 25 different insurance companies, including ICBC. So if you've been in a car accident, we do bill directly to ICBC. And it's a really simple process to book an appointment, clicking on that button. And then we're gonna text you the paperwork or email you a link, and then you can just fill it out online. We'll give you directions, and then we'll see you at the appointment time at the clinic. So really easy to schedule an appointment. As far as the next webinar goes, it's going to be on back pain, and it's going to be called Back Pain 101. It's going to be part of the Lunch and Learn series, so bring your lunch, on March 20th at 12 noon. And I'll be talking about back pain, the causes, how to prevent it, and the treatment options for back pain in the clinic. And that's the number one thing that we see in this clinic, is people with back pain. Now, if you want to get a ticket for that, the best way to do that is to go to Eventbrite. So if you go to eventbrite.ca, and if you type in Back Pain 101 and you type in my name, you're going to see the webinar right here. And all you have to do is click on Reserve a Spot. If you're watching this on Facebook, you can go to the link in the bio, and that'll give you a connection over to Eventbrite. So if you're on social media, or you're on YouTube or our podcast channel right now, just click on the link in the bio and it'll take you over to Eventbrite. You can reserve a spot for this next webinar. If you're interested in what the upcoming webinars are, I do have a list of the webinars. We've already completed the one on neck pain. Today we did Shockwave therapy for tennis elbow, and then Back Pain 101 is coming up next, March 20th. But there's also some other webinars coming up that you might be interested in, like laser therapy, a safe and effective way to heal injuries and reduce inflammation, on March 28th at 7 p.m. Whiplash, what it is and how it happens and how to recover, April 8th, 12 noon. Orthotics and orthopedic shoes, how they can improve your posture and gait, April 18th, 7 p.m. Instrument chiropractic, safe, gentle and precise technique for spinal alignment, April 22nd at 12 noon. And finally, how to choose the right chiropractor for your needs. That's going to be May 2nd at 7 p.m. So these are the upcoming webinars. What I plan on doing is, as we go through a couple more, what I'm going to do is update this list. So when we get to the end of March, I'm going to extend the list down into May to the end of May. So if there's any topics that you're interested in, please type them in the chat right now. You can also leave a comment if you're watching this later, or DM me directly. I'd be happy to review your requests and make that into a webinar. So be happy to go over that, as well as all these webinars are free. So you can join us for free in any one of those just by getting a ticket. The spots are, there's a limited number of spots, so make sure you go over there and get a ticket now so that we don't run out of tickets for that event. I want to thank you guys for joining me today. I hope you learned something from this webinar. I look forward to seeing you at a future webinar. And if you're in the Kelowna area and you need help, I look forward to seeing you in the clinic